So I do actually have the red bar across the top, and you see the little Learn How button here. Just to give you a quick scoot through here, there's also, this is where you can find the healthcare position. We're not talking about the privatization position right yet. This is where you find the LWV position on healthcare. Some information about single payer, also called Medicare for All, although single payer can have other systems besides Medicare for All. What it isn't and how will we pay for it, different legislation, some media, the toolkit resources, and some different organizations that support Medicare for All, ways that you can get involved. And you can see down here a different, larger buttons to get to these different things. Okay, so now we're going to go to the Learn How. And this is our Vermont Concurrence page 2024. And it's all one page that keeps on scrolling down, but so you can go more quickly and get to what you're looking for. If you really just want to see the pros and cons, you can just go right here. If you really want to see some of the frequently asked questions, you can go down here. But what I do hope that people will do is to look at the current LWVUS privatization position, that's right here, and then look at the proposed concurrence. So let's take a look at that right now. The current LWVUS position, so we've got down to the right part of the page. Now we need to actually go to the position. There it is. So here is the current position. The League of Women Voters of the United States believes that when government entities consider the transfer of governmental services, assets, and/or functions to the private sector, the community impact and goals of such transfers must be identified and considered. Further, the League believes that the transparency, accountability, and preservation of the common good must be assured. I'm not going to read the whole thing to you, but you can see down here that it's talking about the services include the electoral process, justice system, military, public safety, public health, education, transportation, environmental protection, and programs that protect and provide basic human needs. Now you'll see down here a bunch of bullet points that that a league, when they're considering whether to support a piece of legislation, they shouldn't just look at our update. They should look back at the whole position and see what are the criteria that you should be using for analyzing the implications of privatizing a particular delivery, a particular good or service. And so these are some of the criteria, and you'll see that one of these here is a provision and process to ensure the services or assets will be returned to the government if a contractor fails to perform. And in our position, we use the language fails to deliver, and we're referring back specifically to this list of things. And so those are considerations. And then down here, it has some things that they recommend as requirements. That you have an open process to allow citizen input and oversight in a timely manner, for instance. But if you could take a good look at this, that's actually a very good position, except that it's only about privatization and not deprivatization. And it can be read, I guess, as not including healthcare. Anyway, so now we're going to look at the Vermont concurrence statement right here. And here, everything that's blue, in our original position, it may have said League of Women Voters of Vermont or our league or something. So now we had to make it be more universal for the whole country. So we replaced it with saying either the League of Women Voters of the United States or the league. So repeatedly it's like the league, the league. And so in the very first sentence, we say that healthcare, like other programs that provide and protect basic human needs, should be considered a public good. And then we have some more information about public oversight, transparency and accountability, ensuring that we have some oversight of the policymaking from administration to accountability. And those are echoing some of the values that are in our public participation position. One of the reasons that may have contributed to the committee not recommending us is that we have current in here, and down lower we refer to where is it? Our current multi-payer, multi-layered system. And we typically want our positions to last for a long time. And unfortunately, we did not see a policy that explained how we should write these things and which things could or couldn't be removed and used by the national organization. We put in these bullet points specifically to be helpful to our members, and the information about the public participation to be helpful to our members, rather than making them go through the entire impact on issues and trying to find all the different positions that might be relevant to it. And rather than making them look up the study report about like, why doesn't healthcare fit in with preview market principles, we just put some of it right here. The ones that seem most pronounced to us that we wanted to bring to our league members' attention. So these bullet points may be another reason that the program planning committee did not approve it or did not recommend it. So then down lower, we talk about the league supporting healthcare as a public good for fiscal reasons. Our multi-layered system contains significant financial waste, including excessive administrative costs and misdirected marketing costs that create additional barriers to care. Therefore, where private entities fail to deliver, the league supports deprivatizing. So this sentence is really important because it doesn't have healthcare in it. It's saying in general, where private entities fail to deliver, referring back to delivering on those contractual requirements that hopefully were created, but in general, delivering on the concept of having good services for a reasonable cost that is affordable by the taxpayers, and doing as good a job for less money, at least one of those two things, compared to when it was run publicly. And then this last one, the league opposes further privatization of needed healthcare and favors deprivatization of services and facilities that are currently owned, managed, or financed by for-profit corporations. Now, another concern that we have heard is, well, you don't say anything about not-for-profits in here, and there's a lot of not-for-profits that are actually acting like for-profit corporations. And that in part because they're competing with them and they want to be able to stay in business and still provide the services that they do. But it's not serving the public to have for-profits and then not-for-profits that are acting like for-profits. And so we felt that the same criteria should be applying to both. Just because you're a nonprofit doesn't mean that you get off the hook. You should still be serving the public. And so you should still be held accountable for serving the public, I should say. And so we did not make the distinction. We talked about the issue of whether it was private or not. And let me go back. So some of the other things, we do have a link directly to the public participation position and to the meeting basic human needs position as well. And if you want to read the original LWVVT on our position on our website, the privatization, the state privatization position. So we don't call it an update on ours because it's not updating something, it's just creating a new position. Down here, you can see some videos are down here. A PDF flyer announcing the forum is available here if you want to help spread the news on that. You can register for the June 17th meeting. If you're seeing this recording right now, or if you were at the June 5th event, then there's no sense to attending June 17th, but we would love for you to encourage other members and spread the word about when it will be meeting. But it's going to be essentially the same information, so there's no need for you to attend that as well. And then as we scroll down here, you can see, if you want to see the list of state and local leagues that have supported this concurrence, you can click here where it says see more. This is where you look at the pros and cons. And this is where you can read some of the information that we sent to our members before our consensus meeting. And this is what we sent to the toolkit so people across the country could know where our process was. This is a really interesting thing here. I had mentioned during the slideshow that Connecticut had deprivatized Medicaid. Well, we have some talking points about deprivatizing Medicaid. We have the full transcript from Sheldon Taubman talking about how their strategy and how they achieved getting the Medicaid services back into the public domain. Here are some other videos on the privatization of healthcare. These are some frequently asked questions. And yeah, that's the bulk of what I wanted to show you on here. So I'll stop sharing my screen. So thank you so much for your time. I do hope to meet some of you at the convention. I'll be there in person. And if you're online, I'm sorry that I won't meet you in person, but I hope that you can join us there as well. If you've seen this recording, you don't necessarily need to go to the caucus, except if you could stop by and get a handful of flyers and help us out, that would be marvelous. Grab them before you go to the caucus and go to another caucus and hand them out there. So very much looking forward to having this conversation and hopefully having our delegates adopt this by concurrence with 2/3 of our members approving. Thank you so much. You take care.